G'day, my name's Paul, a musician, pastor, chaplain, radio announcer, and I'm joining with Creative Communities for this series of interviews across the season of COVID-19. Thanks for following us. And we're joined today with Dr. Simon Towler. Thanks for joining us, Doc.
Good afternoon.
Great to have you with us. Yeah, it's good to have you. Now, you were the Chief Medical Officer in WA.
I had the privilege of that position between 2006 and 2012. It was a pretty interesting period of time.
And I'm led to believe you also have experience with pandemics.
Well, we have had pandemic flu in the period that I've been working at a senior level as an executive in health. A lot of preparation was made for that. In the end, pandemic flu was not as challenging as we thought it might have been. With the early estimates that it might be as much as 6% mortality, it was truly terrifying. We really thought we had swine flu 1918 style. But it didn't play out that way. We had very different patients, had pregnant women, a lot of younger people, but in the end, it wasn't as unpleasant as we expected it to be. But we learnt a lot, but maybe we didn't learn enough.
So that would be my primary question to you today is in regards to safety, how are we to face this pandemic together?
Well, it's going to be really important that we do it together. First message. This virus is more transmissible than pandemic flu was. The idea of how many people will you infect on average, pandemic flu is about 1.2 from every person who got infected. This particular virus, unfettered, on average results in each person infecting 2 to 3 others. That means it spreads more rapidly. You don't have to be on another planet to have seen the information about how this virus is spreading. So first thing is, trying to reduce the spread is pretty important for all of us. So there's a lot of things you can do for yourself, but there's a lot of things you can do together to look after each other. Obviously for yourself, great hygiene, listening, wash your hands, keep yourself in a healthy state. Try not to, if you're feeling unwell, be around other people. Get a medical checkup if you can. But if you look to consider other people as you become unwell, you will spread the virus less. You've all heard about the idea of social distancing. Viruses don't jump and crawl down the street. You have to be close to somebody. We're talking about a distance of about 1.5 to 2 metres separation. Now in this country, we like to socialise. We've seen a lot of people still having parties. We're going to have to change the way we live to try and keep control of the virus for the near future. But as a consequence of that, the social changes are profound. We're seeing things which we've never seen. We're seeing people losing their jobs. We're seeing huge queues outside Centrelink. And the people who are most vulnerable are the older people in our community and those people who have vulnerable health conditions. So we need to help them. We need to keep in touch with them. My wife is helping look after her mother and stepfather. They're living in their apartment. We're doing their shopping for them. We check on them every day. We're trying to support them both in terms of mental health support, in terms of the challenges they face, and the simple things of day-to-day encounters with the world so that they're less exposed. They're both in their 80s. If they get this virus, they have a 1 in 10 chance of dying. And what would it feel like if you were a younger person and took this casually and you infected your grandparents and they died? How would you live with that? So support is critical. Thinking of somebody else is important, but trying to work out how you're going to help somebody else matters a lot in the current environment. We need to be a community, not just worry about ourselves.
So we're hearing continually these messages of social isolation and going into increasing lockdown. What can people do to stay healthy in terms of going outside? Are we literally the only way to deal with this? Are we forced to stay inside away from people? So tell us how we can safely and healthily exercise, get outside, stay sane.
Yeah, you can get outside. I've seen great videos from people, Australians living in other countries. They have kind of a lockdown overnight where you're locked up in your home. But during the day, you're allowed to get out. You're just meant to practice the principles of not being close to other people. And in fact, we've got a lot of space in Australia. The challenge in Italy, great social place, but 206 people per square kilometre in Italy. Australia's got a lot more room than that, and there's still a lot you can do. We're also fortunate we have pretty big houses. People often have gardens. They often have somewhere they can exercise within their own space. But you can get out. Being outside is not a problem. It is about how close you are to other people. If you're in a family and you're both well, there's no reason why you can't both go walking together. It's completely acceptable. Ride a bike, go for a walk. Obviously things like gymnasia and swimming pools, they're all going to be closed. So the kind of exercise you might get to stay healthy is a bit more very traditional. What you can do on your own, get out and about, and completely reasonable.
So we can do that, as you say, but if we are inside a lot more, what are some of the things we can do to stay healthy and safe indoors? And essentially, I guess if we're talking about our mental well-being as well.
I think there's a lot of issues in that. I mean, we're very concerned about the mental health of the community. It's not just about the difference of being in a situation which we're not used to, where you're kind of locked up with the risk of cabin fever. You're also in a situation where people will be under duress simply because they've lost their job, they're not sure about the money, they're not sure about the circumstances, they may be frightened. Access to things like medications, going to the pharmacy, things that you need for your own well-being and health will cause challenges. So support for each other in the home environment is going to be a challenge. You can stay healthy by doing the obvious things. You don't need to sit down. You can get up and work standing up. You can walk around. You can do things in the home. You can try and focus on eating well. In fact, maybe it's even possible to take advantage of this opportunity, but don't sit on the couch and just eat, and don't just drink.
Some good advice there. What would your Stronger Together tip be for people tuned in now?
It's really interesting. We're a modern society. We're kind of used to the idea of communicating by other means. In my family, we've got family members who are living in the US. We communicate with them very frequently via iPad and iPhone, computer linkage, talk to people. It's great to catch up. And that's really supportive. I mean, if you've seen some of the videos from Australians trapped overseas, that simple communication matters. We need to look at some ideas for how we do that more locally. You don't need to be very far away. There's been some amazing videos of people living in the same house where one of the family members is COVID-19 positive and the other one's still negative. They've actually created physical separation. They're talking within the house through their own internal phone systems. So you need to be a little bit creative. Yes, we're all going to come under the duress of the fact that the IT networks are struggling. I've had so many phone calls drop out in the last 24 hours. It's extraordinary. But if you take your time, find the moment, you can certainly stay in touch. You need to be listening. You need to be hearing what people are saying. And if people have got concerns, you need to try and address them. The doctors' clinics are still open. They may be taking a telephone call instead. We're looking at people increasing support line access. In our own church, because of the rules around congregations can't meet, then we're hoping that the pastoral staff will be available to provide support. We need to look for some creative opportunities. But a lot of the support starts at home, supporting each other, being conscious of what's going on, and recognising unless we look after each other, this is going to be very difficult. I can't imagine if I'm facing, well, I won't be facing because as a medical practitioner, I'm still going to be going to work. But for a lot of other people, you might be shut up in your house basically for months, just going out occasionally. It's going to be a very different experience.
Wow, there's a lot to take in there. Thanks so much, Dr. Simon, for joining us today.
It's a pleasure, and I'm more than happy to help if I can.
Thank you. That's Dr. Simon Towler there, a former Chief Medical Officer here in WA, and he's got some great advice for us. We're going to have more of these chats, and you can follow them at Stronger Together online. We'd love you to join us there. Until then, make sure you do stay safe. Take the government's advice on how to look after yourself and others regarding COVID-19.